Hi, everyone. Welcome back to the Reality and You Foundation. Today, we have a very interesting topic that we are going to cover. Our topic for the day is going to be on mental health and its impact on cardiac issues such as heart-related issues. Today, we have with us Dr. Sarah Gauci. She is an associate research fellow at the Food and Mood Center in Australia. Her main interest lies in health, lifestyle, and mental health. She is going to talk about the interrelationship between the cardiovascular health, lifestyle, and how it could have an impact on depression and anxiety. Thank you so much, Doctor, for being with us. I just want to start off, is there anything that you want to add in terms of your research that you have done?
No, I think that covered it. So I'm an early career researcher, so only a couple of years post my PhD. And during my PhD, my research really focused on how lifestyle, particularly diet, is related to cognitive health through cardiometabolic mechanisms. But now, after I finished my PhD, my research is more focused on how we can use lifestyle to improve the secondary prevention of heart disease. We're focusing on improving mental health after a heart attack.
Yeah, that's I think that's something that we will look in more detail as we go along. So just to start off with, Doctor, can you tell us, how would you associate mood symptoms with mental health? Is there a scientific basis, a neurological basis to this?
Yeah, so I guess when we talk about mood, it's more of a spectrum. So people can, and it's something that people experience day to day. So our mood fluctuates naturally within day-to-day changes. That we are a bit more concerned when mood starts to develop and impact people's day-to-day functioning. And that's when people start to develop clinical mood disorders like depression and anxiety.
So, but is there a neurological basis where we see that, right now we know a lot of people on social media, there are a lot of diets being prescribed, we know intermittent fasting, we know keto, we know Atkins, we know the Mediterranean diet, so we do see a lot of eating disorders. We do see a lot of depression and anxiety while people change their diet.
With the neurological basis, I guess we don't know the single thing that causes poor mood, but we know that lots of biological mechanisms might contribute, and one of the ones that I like to focus on is diet. So over the last decade, we've had an increasing amount of evidence showing an association between diet and mental health.
Right.
There are many observational studies that have shown that specific dietary patterns, mainly the Mediterranean diet, are associated with a lower risk of mental health conditions.
Oh.
My own research focused more on the association between diet and cognitive health during my PhD. So we know that what you eat impacts your brain health, both cognitively and mental health side of things.
So, Doctor, can you give us a little more specific information? So you said the Mediterranean diet, is definitely more beneficial. In what terms would it affect, your emotions or your mood? Does it have any particular reasons why there's an association seen?
Yeah, so there's a few different ways it impacts mood. So we know food improves your mood from a day-to-day level. So when you eat something, you enjoy it, makes you feel good. But the research we're focusing on is a bit more about how the food impacts your brain health through different biological mechanisms. So one of the main mechanisms that we seem to find is that it impacts your brain health through inflammatory markers. So what you eat impacts your inflammation in the body, and that impacts your brain health through that way. We also see an interaction between what people eat and their brain health through various biological mechanisms, including the microbiome. I don't do too much research in that space, but that's one of the other pathways. So there's lots of different pathways that how what you eat impacts your brain and mental health. So it's not just one way. And the research I focus on is also on how it impacts your how diet impacts your brain health through your heart health as well.
So when you're saying the brain impacts your mental health, so are we, and cognitive abilities, so are we saying attention, memory, what particular abilities are we saying that food would have an impact on?
So with the association that we see between diet and cognition and cognitive outcomes, a lot of it is in attention and memory, and we do see the association between what people eat and the risk of developing dementia and Alzheimer's disease later in life. So it's, the full spectrum of cognitive abilities, from attention day to day to developing cognitive impairment later in life.
So just on a very base level for our viewers, what would be a basic diet that somebody needs to follow in order to prevent Alzheimer's or memory loss or dementia at a later stage of their life?
Most of the research and evidence is for the Mediterranean diet. And this includes a diet that's high in fruits and vegetables, legumes, nuts and seeds, and olive oil is another component of the Mediterranean diet, and it has a lower to moderate intake of red meat and meat, and a higher intake of fish than sort of a typical diet. So those are the types of foods that are associated with improved brain health. On the other side of things, there's evidence that adherence to a more Western style diet that's high in ultra processed foods is related to more impaired brain and cognitive functioning. There's some evidence coming out in that space, and a bit more evidence in the space of how ultra processed foods are related to worse mental health outcomes. So I guess the evidence just shows what we probably already know, that we should be eating more fruits and vegetables, plant-based foods, good fats from olive oil, and reducing the ultra processed foods like packaged sweets, sugary sweetened beverages, and packaged foods.
So you're in effect saying that, a Mediterranean diet, a lot of plant intake would not only be beneficial for your cognitive abilities, but also the heart in general.
Yeah, so for cardiovascular health as well, we do see a similar association of Mediterranean diet being protective of primary prevention of cardiovascular events and secondary prevention of cardiovascular events for people who've already had a cardiac event.
Okay, so generally for our viewers who have undergone, a lot of young people we see have had, heart attacks. So what kind of diet would we be prescribing to them, as well as what would does a heart attack have an impact on the mental health of the individual?
So the evidence for reducing the risk of secondary heart event is similar to what I said before with the diet that's high in fruits and vegetables, legumes, nuts and seeds, olive oil, and low in the ultra processed food. So we see a similar pattern across brain and heart health for the protective effects of a Mediterranean diet. In terms, and again, emerging evidence for the sort of adverse effects of adhering to a ultra processed foods and Western style diet for these things. In terms of how you're following a heart event, your brain health is impacted. So, sorry. We know that the brain and heart have a bidirectional relationship. So that means your brain health impacts your risk of having a heart event. So if you have poor mental health or depression, you're at a higher risk of developing cardiovascular disease and having a heart attack. But we see the reverse as well. So for people who've had a heart attack, they're at an increased risk of poor mental health following. In the early period, recovery period, We call this the cardiac blues. So it's a natural response to the trauma of a heart event where patients experience a change in their mental health. They're feeling a bit more anxious, worried. Some people experience anger. And this is what we know as the cardiac blues. And for many people, about 70% who experience this recovers in the first few months after their heart event. What we're more concerned with following a heart attack is the 1 in 5 people that go on to develop major depressive disorder. And this is concerning because major depression following a heart event increases their risk of subsequent heart events.
Yes.
And reduces, obviously, quality of life. But it also reduces their ability to undertake and participate in important secondary prevention programs like cardiac rehab.
That's interesting. So you were talking about, I'm just going to go back to what you said earlier, is, having a mental health issue, such as a depression, would have an impact on your cardiovascular activities. So in that case, most people who do suffer from a mild to moderate depression need to understand that this is going to have a physical impact on their body.
Yes, yeah, I guess we see that, and it's from a variety of different pathways that increase the depression relationship with poor heart disease. So we know that there are shared biological pathways like inflammation, for one, so that's attributed to depression, but also cardiovascular disease. We also know that some of the sort of pharmacological treatments for depression can, in some cases, or other psychiatric illnesses related to impaired cardiovascular disease. But we also know that one of the major contributions is that people who are depressed often experience sort of social isolation and withdrawal. They might partake in worse health behaviors because they're not feeling up to cooking a healthy meal or going and exercising. And that's related to poor cardiovascular outcomes through those pathways. So it's, a mixture of behavioral and biological contributions that contribute to that risk.
So when we are looking at preventive measures for a heart attack, you would say that having a healthy mind, how they normally say it, a healthy mind leads to a healthy body, and vice versa. So you're saying that in order to have a good, healthy heart, you have to be functional, do your exercise, be engaged in your day-to-day activities.
So that's, I guess, the goal for people would be to be able to sort of look after both their heart and their mind. And as I said earlier on, there's evidence that the healthy diet and the healthy lifestyle is related to both.
So do we have certain markers? Because we do know that, some people tend to dismiss by saying it's, we are feeling low and that's fine because it's part of the, the day-to-day rigor. We do not feel like doing social activities. They isolate themselves, probably not understanding the impact that it's having on their physical health. But, there are cases, and people tend to go to therapists and doctors only when the depression is at its peak. So is there any study or is there any research from whatever you've read, stating that, depressive symptoms should be picked up at an early stage?
I'm not familiar with particularly much of the research in the sort of earlier depressive symptoms and their relations to cardiovascular health. Most of the evidence out there is for specifically people diagnosed with major depressive disorder and other psychiatric illnesses. But I would say it is like everything is on a spectrum. So the earlier depressive symptoms probably do contribute particularly through the behavioral pathways. The thing that I like to focus on when talking about diet and lifestyle is that I feel like it's more motivating for you to eat a healthy diet when you focus on how it makes you feel in your mood, more so than the physical health that we don't always notice, or the change in weight. I think if we focus on weight, that can be something that's hard to change and hard to move, and it can be unmotivating when people change their diet and they don't see a change in their weight. But the research out there on the association between diet and improved mental health, they find that it's regardless of weight loss.
Wow.
So you can change your diet to improve your depressive symptoms, regardless of whether you lose weight or not. And I think that's really powerful message that, it doesn't have to be, the end result doesn't have to be losing weight to improve your mental health.
So I think all over the world, we've seen, a huge rise of mental health issues among adolescents, specifically young girls. I think this study is extremely impressive because while they also want to maintain a particular body image, I think what you're saying is it's important to have a particular diet in order to also address their mental health issues, which are very, very high right now.
Yes, and in terms of the evidence for in adolescents, I'm not very familiar with the research base, but there has been a systematic review that explored the association between diet and depression in young adults and adolescents. And there is an association there similar to what we see in adulthood. So what you eat, it does relate to, can impact mental health in adolescents as well as children.
So we also said that, people who've, undergone heart attacks may be more prone to depression and anxiety. Like you said, initially they may be angry and then they isolate themselves. They are not able. So do you see, like we spoke about depression, but I've also had cases where, people after a heart attack episode, they're extremely, obsessive and anxious about having further attacks in the future. And so a preliminary heart issue does lead to extreme amounts of anxiety, insomnia, and things like that. So, Doctor, what are your thoughts on that?
Yes, I think that's one of the I guess the experience of a heart event is a very traumatic experience, and it can be quite scary and life-changing for people, and that fear really contributes to their depression and anxiety after a heart event. I think, yeah, it is really important that we can sort of that patients after a heart event can seek the appropriate care and support for their mental health so that they're able to focus on recovery of their heart event. And I think, yeah, so really supporting mental health following a heart event is really important.
So in that case, people who have undergone heart events, should ideally, like you spoke about the cardiac rehab, can you tell our viewers what does one entail in a cardiac rehab?
So yeah, of course, cardiac rehab is a multidisciplinary program that is designed to reduce the risk of recurrent cardiac events and improve quality of life. In Australia, that's where I'm located, programs typically last around 8 weeks, but across the world, there are varying time limits and varying in numbers of sessions. But they're a multidisciplinary program, so they encompass like risk assessment, education around people's own individual risk factors, healthy eating advice, exercise training is a large component, and another really important component is the psychosocial support. So usually the guidelines recommend screening for people at risk of depression, and then tailoring the referring on for those patients that are at high risk of depression or are already depressed to seek additional support. But yeah, it's a multidisciplinary program that has been found to improve reduce the risk of having secondary events and improve quality of life. But what's really concerning is that despite the strong evidence supporting the effectiveness of these programs, only around 30% of eligible patients are referred to cardiac rehab around the world. The data is pretty similar, and even fewer attend and then complete the program. So we really want to see ways that we can improve attendance after a heart event to cardiac rehab, because it has such positive impacts on people's physical and mental health afterwards.
That's really interesting. So I think, like you spoke about the psychosocial support, that is a very, very important component even after the cardiac event.
Yes. One of the things that we see across the literature that people really appreciate from cardiac rehab is the peer support component. So being able to participate in a program with someone who has a similar lived experience of a heart event than you do is really beneficial, and being able to hear about other people's experiences that are similar to yours. I think that's a key message that I get, which I hear from consumers, but also that's a really obvious in the literature around that. That's a really important component for people. But it's also really important that they also get the psychosocial support from the program itself. So it's really important that programs can screen and highlight those at risk of, and those that might need additional support.
So just to elaborate on the psychosocial, so when you're talking about psychosocial support, can you tell us a little bit in detail as to, what are the components of a psychosocial support?
In cardiac rehab, I guess that each program differs. Some programs in Australia have a psychologist on the team, and I think that's great, and would love to see more programs have that availability where consumers can get that one-on-one support. A lot of the components, the psychosocial support, is that peer group formation, so peer support from others. A lot of the psychosocial support also includes just educating around the normal sort of trajectory of the cardiac blues after a cardiac event, that it is normal to experience that change at the start and feel, feelings of fear and anger and sadness. That's a normal experience to recovery, but understanding when you need to seek additional support. So that education on what are the signs and symptoms of depression and anxiety, and when to seek additional support for those.
So you're saying either before or after a cardiac event, ideally people should seek, a consultation with a therapist in order to maintain an adequate functional heart.
I guess that's not the sort of overarching guidelines, that it's not suggested that every person, because it's not everybody has access to a therapist or psychologist, but I think through cardiac rehab and having access to that should be able to highlight or screen the people that might need additional support and get access in those.
Doctor, a lot of people associate cardiac events with stress. So a general term that they tend to use is, oh, there were so many stressors in his life. So I'm just going backwards to, not calling themselves depressed, but more stressed. So are we also saying that when we are talking about mental health and cardiac health, are we saying that we are, we know there is a strong association between depression and cardiac attacks, but what about stress? When we're talking about stress, what are we looking at?
I think we do see evidence that life stresses are related to cardiovascular events and increased risk of cardiac events, and that encompasses work stresses, family stresses, and those things. So I think the real important thing in reducing in being able to reduce day-to-day stress is just having that, I guess, work-life balance where possible, and being able to look after your mental health as well as your physical health. So sometimes when you're feeling overwhelmed, it's important to be able to understand when you need to take a break and look after your mental health as well.
Doctor, I just want to know, through your research and, do we have certain factors where we say that it is more seen among a particular gender in terms of females or males? Do we have age criterias for this prevalent more among the age group of 40s to 60s? What kind of population is more prone to this?
I guess, well, we know that heart events are more common in older populations. And while people typically think of men when they think of heart attacks, that they only happen in men, that we know that heart attacks and cardiovascular disease is also the #1 killer of women. So that's something that's really important to highlight, that women also have heart attacks and should seek treatment when they have symptoms of a heart attack. And in terms of the risk of depression following a heart attack, there is some evidence that this is a higher risk in women. And this may be because I guess we see that higher risk of mental ill health in women across the lifespan. But particularly we see it also in people who have had a heart event, that that increased risk of poor mental health. We also see that women are less likely to be referred to or attend cardiac rehab. So women are the ones also less likely to seek that additional support when they need. So that's, I guess, an area of something that I'm really interested and passionate about, is how that we can improve mental health care and support for women after a heart event, as well as getting them to cardiac rehab and keeping them there.
So is there any particular reason for why that pattern is occurring, like women seeking less rehab facilities?
Yeah, so we see there is a bit of data. Firstly, one of the reasons that women are less likely to be referred to cardiac rehab. And one of the reasons we think that this may be is because women tend to be older when they have their first cardiac event, so they might not be referred based on their age. But we also see women experiencing more barriers to attending cardiac rehab. So women have increased carer responsibilities at home, which means that attending cardiac rehab is more difficult for them. Women also tend to experience more barriers to accessing services by traveling. So they might have more barriers to traveling to cardiac rehab and attending. And one of the other barriers that we see is that often programs are mixed gendered, so that it's cardiac rehab is predominantly an exercise program where it includes men and women. And we hear that women sometimes might not be comfortable in that situation to exercise with a mixed gendered program. So I think, being able to tailor programs to women's specific needs and risk factors, but also offering women's focused cardiac rehab where possible, so that women can attend at times that work for them. But also, if having the option to attend a women's only class might be beneficial.
Wow, and in terms of age, you said people who are older may be more prone to cardiac issues. Are we looking at a particular age bracket?
I guess, I don't know the specific sort of onset of when cardiovascular health increases, but we do see it more predominantly in people sort of over 40 years of age. That doesn't mean that heart attacks don't happen before then, but we do see it as people get older, their risk of cardiovascular disease increases, and that's something that we see in the data as well.
And you've done some interesting research on, of course, the comorbidity and occurrence of these. So do we have other factors such as blood pressure, diabetes, kidney issues? Are we seeing any other connections that you've noticed?
Yeah, so I guess those are all risk factors for a cardiovascular event, and those also having comorbid factors increases your risk of having a cardiovascular event. And if you've already had a cardiovascular event, having those comorbidities increase your risk of a secondary event. So I guess, it's really important to sort of understand your individual risk factors by, speaking with your general practitioner about them, And yeah, just understanding your individual risk, because that I guess differs for each person based on their, complex underlying risk factors.
So in terms of doctor prevention, like we said, we could have a intervention of a psychologist or a physiotherapist after the cardiac episode has occurred. In terms of intervention in the 8-week program, what would in terms of mental health, in terms of dietary health, I think you spoke to us about the Mediterranean diet, but in terms of mental health, what are there tools and techniques that we can use that will help the cardiac patient?
There is some evidence for cognitive behavioral therapy after a heart event, improving depression symptoms. So I think the treatments for depression after a cardiovascular event aren't different to treatments of depression in the general population. The research I'm interested in doing is understanding how we can use those lifestyle treatments, so like diet and physical activity, and use them to treat both the risk of depression and the risk of cardiovascular disease together. So at the Food and Mood Centre where I'm based, they conducted the world's first trial of a Mediterranean diet to treat depression, and found that was being supported by an accredited dietitian to adhere to a Mediterranean diet is a therapeutic strategy for treating major depression. And more recently, the Food and Mood Centre, there was a trial led by Professor Adrian O'Neill that found that group-based lifestyle therapy, which included diet and exercise counselling from trained health professionals like dietitians and exercise physiologists, was just as effective as traditional psychotherapy for treating mental health outcomes. So after 8 weeks, participants receiving the lifestyle therapy showed a 42% improvement in their depressive symptoms, compared to just a 37% improvement among those receiving psychotherapy. So these shows that treating depression using lifestyle therapy is a sort of effective avenue. And I'd like to see, and my plan is to do some research seeing if we can see the same results in people after a heart attack.
Wow. So when you're saying in terms of lifestyle changes and lifestyle therapy, like you pointed out, it's more to do with your diet and your exercise routine.
Yes, that's where the evidence we have now. So focusing on diet and exercise. But there is, I guess, lifestyle is a spectrum, and there is more emerging evidence and looking at ways to improve people's sleeping habits. Being outside in nature and the green therapy and blue therapy, being around green spaces and being near water as well. There's some emerging evidence in the space that that's really an important component. So yeah, the pillars of lifestyle therapy, most of the evidence currently being for exercise, and then more growing evidence in diet and nutrition.
That's really interesting. That's really interesting. So maintaining a healthy diet, exercise, blue therapy, like you said, being in nature. What about things like mindfulness? I think post-COVID, we've seen the use of the word mindfulness a lot. Any research on that?
I think, yeah, there is some research on mindfulness, and I've seen some really interesting studies incorporating mindfulness in cardiac rehab programs to sort of treat the experience of depression or mental health after a heart attack. So I think, yeah, mindfulness is another potential avenue that could play an important role.
So in terms of mental health, doctor, just going back, so a person who's suffering from depression, would it then, the antidepressant or the anti-anxiety, would that also help in maintaining an effective heart, health? Or we are just talking about therapy?
So I guess it's a bit of a complex thing with the outcomes for sort of treating depression with medication and the results on cardiovascular outcomes. So across the evidence, we don't see significant improvements in cardiovascular mortality rates for people treated with antidepressants. And there's lots of research in the space trying to figure out, I guess, why that is. Because I think it's really important that we treat their depression, and antidepressants do that, so they improve their depressive symptoms. But we're not seeing an improvement on their cardiovascular outcomes for those people. And there was recently an editorial published that sort of tries to look at why this is, and one of the sort of suggestions is that maybe we need to target that inflammation a bit better, to target the causal pathways for both depression and cardiovascular events, heart health, through maybe inflammation. So I guess that's one of the reasons why I'm also really interested in diet, because we do have good evidence that it treats both depression and cardiovascular health. So maybe how can we use that as an adjunctive to medication? So I'm not saying that you don't take the medication, but saying that can we add things to the treatment profile that we can improve outcome.
And when you're talking about inflammation, can we just stress on what the inflammation is all about?
So I guess it's a bit complex. So we see inflammation is a biological pathway that we see that's related to both for brain outcomes and heart outcomes. And it occurs through lots of different things. So when you're unwell, you have a short-term inflammation from having a cold or a flu. A lot of the evidence shows that if you have longer-term inflammation, that's related to worse brain health and heart health outcomes. And I guess there's lots of factors that contribute to inflammation, and one of them is diet and nutrition and exercise. So those are all factors known to reduce inflammatory markers and reduce that low-grade inflammation that we see.
Doctor, I just want to touch upon, binge eating. So a lot of people we see in the modern world, so say, on the weekdays, they maintain a discipline in terms of diet, and they go on to binging during the weekends. Would you see this as a healthy pattern to heart health and mental health?
I think, well, in my sort of research, I don't do too much on binge eating patterns. And I think from a more personal point of view, I think one of the reasons that we might be seeing that pattern is that people think that a healthy diet is very restrictive, and that we don't include, they might during the week not eat the things that they might be craving or wanting, and then that might result in binging later in the week. I think the approach that one of the reasons why I like the focus of the Mediterranean diet is we should be focusing more on abundance and not restriction in what we eat. So I think trying to increase the amounts of fruits and vegetables and plant foods in our diet, instead of focusing on the foods we can't eat, and we might see that as have a more positive outcomes. So I think not too much commenting on the binge eating, because it's not an area of research that I am familiar with. But just moving the focus away from restriction to more focusing on what more can we add to our diets and lifestyles, I think it might be more positive.
So, since, like we said, the cases and the numbers of heart issues and mental health issues have been drastically on the rise, what would be last few suggestions? Like, you've given us a huge tip on the Mediterranean diet. You've told us about maintaining an adequate exercise routine, enabling mindfulness and CBT practices in your daily life. Any other suggestions for the young users, in terms of adolescents, young adults, and any suggestions for them?
I think, well, my overarching suggestion with a healthy lifestyle and ways to, I guess, protect your mental and heart health is to find things that you enjoy eating that are also good for you, and focus on that more of the abundance than restriction. So trying to incorporate more different plant foods and trying different new plant-based foods and vegetables, and incorporating an abundance into your diet is I think really important. In terms of finding exercise that you enjoy, I think finding enjoyment in the things that you do is really important. Finding ways to get outside and be in nature, doing something that you also you enjoy. So I think my overarching tip is to have less sort of rules and tick boxes that I need to eat a healthy diet, exercise, but finding things that you enjoy that incorporate that into your lifestyle is really important.
And my last question is, any suggestions on, non-dairy products or the vegan, the diet that has come through? So a lot of people have, have started having gluten-free diets. Any suggestions on these?
I don't know. There's not so much evidence on those diets and their relationship between, I guess, both brain health and cardiovascular events. I think if you have a intolerance to dairy or gluten, then that's something that you should, I guess, avoid eating, because eating those foods would increase the inflammatory response.
Right.
But in terms of if you don't have an intolerance, I don't think then there's no need to avoid those food groups.
Okay. In terms of, people suffering from mental health and depression and anxiety, any preventive measures for them so that they do not, collapse with a heart attack eventually?
So for people that are experiencing poor mental health, I think trying to, I guess, seek help so that you can look after your mental health, and then finding ways to have a healthy lifestyle that looks after your mental health and physical health is really important. So, there's nothing wrong with going to seek help when you're feeling down and not feeling right. And I think that's really important to highlight, that you should seek help for your brain health, just like you would seek help for your physical health. If you're feeling something not right, you go to the doctor, you seek help from them, a specialist in that area.
Thank you so much, doctor, because that's going to sort of give us hope that, people should go and seek help, not only because they're feeling low or anxious, but because it may also have an, underlining impact on the physical parameters of your body. So thank you so much for this enlightening talk. And I'm sure our viewers, this is very, very helpful to you. Thank you.
Thank you for having me.